I'm not able to hear.
Okay, so, brother, can we start?
Yes, brother, you can start, brother. We are waiting for your beautiful speech. Yes, brother.
Yes, brother.
Yes, brother, you can start. Welcome.
Okay, thank you. So, today we are talking about acupuncture and myofascial lines for the hip, pelvic, and low back pain. So, there is a short introduction for me. Then, introduction for treating the low back pain, pelvic regions, and lumbar area. The anatomy of the treating the hip posterior, anterior, and lateral and deep regions. Then we have to read moment in the necessary for getting good response for treating the hips. Then understand how to use arm and leg points and when they will and will not be effective. Non-local needling versus local or direct needling. Then it is start with digital needling and move proximally towards the area of the pain. Then create realistic expansions for outcomes for treatment. So till now, in past 3 days, I told you about the facial lines. Yesterday, I also told you about facial lines in last moment. So this is the back facial line, back superficial back line. Then this is the medial line. Then it is lateral and it is superficial deep line. There are three categories of patients based on the responsiveness. How we treat. First, the yin yang of the contraction and the strain. All of you know, pain may be felt in the area of muscular contraction or strain. For any muscles that is short, there are antagonists which are lengthening. I told you in first day, when one muscle is lengthening, another is contracting. When I am doing arm flexure, then my biceps are contracting, but triceps are in lengthening position. When I straight my arm and in extended position, then biceps is lengthening and triceps contract. Chronic contraction and strain affect the opposing muscles group. Understanding this dynamic will allow you to have more accurate diagnosis, reduce adverse needle reactions, and get you better clinical results. So, most important things, accurate diagnosis. So, direct and local needling into contractions and stents vary according to acute sprains or stent, acute sprains and stents, lengthening of the muscles and acute contractions of the muscles spasm. Don't needle locally for most acute conditions. Start with non-local system 1, digital needling. For acute problem, always do digital needling. Then for chronic contraction and strain, those pains are very old and condition are very old then and all trigger points. Then you often use and respond with the local needling. But local needling may be aggravate some condition, especially if it is a neuropathic condition. And in case of hypertonicity, the muscles is hypertone, then structural and postural change are often necessary. because structure or postural change are very important in every conditions and in every diet. And in chronic conditions, you see, yesterday I told you, day before yesterday I told you about compensation pattern. When one muscle is doing more work, then other is weak. When one muscle is weak, then his synergic muscles and antagonist muscles are doing more work. Because of this reason, they are getting loose and weak, and the strong muscles become more strong and contractions. Okay. Then chronic contractions or strengthening in one group of the muscles can cause the antagonist to become weak and strengthened. Discuss how this relates to the various patterns and disorder of the hip and back. So treatment principle, chronic contractions and strengthen where there is the strain. So tensegrity, it is the main thing. Tensegrity, tension plus integrity describes system of compression part in a net of tension and how tension moves through a system. How it is moving, you can see it. Like the meridians and fascias are integrated system that are connected to the entire body. So we are here seeing one is the flexion and contraction in this picture. If you see, one muscle is, this is the agonist, then antagonist. Okay. The biceps is the chief flexor of the forearm. The triceps is the chief extensor muscle of the elbow joint. Tension is a pulling force and creates strain. Our job is to find where their tension is being held and how the best release it. How does tension move in each client? What group of 3 to 6 needles will be released? Fascia connect the interior and exterior and plays structural and functional role. Externally, joints in the fascia often correspond to the meeting points in the meridian theory. Internally, the facial connections related to the internal external meridian theories and Dr. Tan's system. Dr. Helen Legwin's research has shown that acupuncture stretches fascia when grabs and traveling occur. When we are rotating the needle, then it is stretching the fascia. And if you want to experience this thing, then put one needle on yourself on any point, then rotate it. Then you feel the fascia is tightening or that area and it is stimulated. Then measure facial line, back line, front line and lateral line. Then deep front line, then spiral line, and then functional line. Then fourth condition is the myofascial arm line. In starting, I told you 4 planes. These are 4 planes. Okay. Here you can see this is the back superficial and back deep arm line. This is the front superficial, this side front superficial, and this side front deep arm line. imaging the spine and long bones. In the ten and tongue system, we image long bones to the spine and find that points located around the distal ends of the long bones, treat neck and points near to the proximal, and treat the lumbar and abdominal area. So traditional examples of this include LU7, UB60, and GB39 for neck pain. We are using. Then UB40 for lumbar pain. UB40 for lumbar pain. The Liu Zhang and Yao Tong actually are example of this on the hands and along the metacarpal. So these 2 points are here. One is here, another is here. On first
Maybe
and
correct, sir.
second and third metacarpal bone and third and fourth metacarpal bone. Okay. Along the metacarpals, GB41 for the Dowmine is used for treating lumbar and pelvic disorder, and it is the proximal portion of the fourth and fifth metatarsal. The attachment of the lats to the proximal portion of the lumbar also demonstrate this. So here you can see the whole spine is covered by latus dorsi, and this is the long bone. So top is using for lumbar region. As I told you, here in this region, shoulder region, deltoid points, for which condition they are treating in tongue and ten, they are treating opposite side hip pain. Point is on proximal, then on digital, on this side, it is treating neck pain. And these joints are also very digital, wrist joint. So, radius and ulna, then tibial and fibula, humerus and femur. These all bones are long bone. Okay. So in some systems, we are putting needles in this area for treating lumbar back pain. As the point 33.08 and 9.
The location of the point.
I am showing you. Then common points for hip pain. Common points for hip pain. Then in this session, you see TCM and tongue's point. Then TCM points LI4, Sengio 5, gallbladder 41. Then GB meridian points gallbladder 29, gallbladder 30, 31, 34, and 41. Then urine bladder 40, UB57, UB60, then stomach 31 and stomach 40. For using hip areas pain. Then for groin pains, TCM, liver 3 and local points on the liver and spleen chain. Liver and spleen chain. And tongue style for groin pain, Lingu 22.05, Li 4.5 pins, then 33.12. Then in tongue spine for the hip, shoulder triplets, superficial back arm line, then 33.08, 33.09 on the superficial back arm line, then thigh lines, male 3 GB and lateral line. Hip triplates locate on this side. In TCM styles, primarily utilize the GB and UB meridians, lateral line and the superficial back line. Liver and kidneys patterns may also be recognized as in the B syndrome. Liver, kidney, and D front line. Then tongue spines, the shoulder straplets and 33.08 and 33.09 are on the superficial back arm line. Here, then, and can affect the glutes through the back functional line. This is the back functional line. Okay, it is joining with the superficial, then it is joined with the let us be dorsal, then it is treating opposite sides, glutes muscle. These only get to a superficial level and can be as effective as needling digital points on the GB meridian like GB31, thigh 9 mil, GB34 and GB39 mil. Then Dr. Mayer's hip triplates are located points in the hip but needles on the opposite side as the pain. Then shoulder triplates, you see 44.03 shoulder center vertical. Three lines, three needle, Jing Chong Jing, Fang, 2 Chun proximal, and Jin Chong, 2 Chun digital to the Jin Chong 1, pain in the hip and buttocks. 44.06, shoulder 3 needles, Li 15, Jin Quen and Jin How you hip joint pain in the femoral acetabular joint. And there are a variety of other shoulder triplates combinations such as the using the horizontal lines from Jing Jiang. This method using in Li Bai and Axia Q. Using the vertical line is not always necessary. And tender points vary from the client to client. It is not necessary on the same point there is tenderness. It depends on the different type of patients. Then needling the three most reactive points in the shoulder appears to give the best results. So these 3 points you are watching. 3 and 3. A good protocol for hip pain. The local points for hip pain 88.08. Pacify the spine 3 needles from GUB 36. Move medial and lateral 0.5 and 1.5 and 2.5 pound. 88.09. Fortify the hip 3 needle first point halfway between the apex of the iliac crest and greater truncator. So, if you see in this picture, this is the one greater truncator. It is visible to you or no? Okay. If you are watching here, then it is the this is the greater truncator area. And here is the iliac crest like this. Then this point is the halfway. It is the halfway. Then another is up and down. Okay. Then GB 29 and GB 30 are here. If you see in blue color, that color is given here on the same those points. Okay. Much like the shoulder locating, the 3 to 5 of the most sensitive points and surrounding the hip area is effective local technique. Needling may be done IPC lateral or contralateral. For non-reactive clients, local points with the electric acupuncture may be necessary for optimum result and for maximum result. Then additional points for the hip pain. Then leg yin meridians, deep front line, lever 3, lever 11, then SP6 and SP9, lower 3 empower, then kidney 7, kidney 8, axial lift and yoke, then kidney 9, deep front line points for pelvic condition, yin kyo indicated for the hip and low back pain. Stomach meridians, 4 horses and Lu deficiency for back pain. Lu deficiency, lungs deficiency. Okay, 4 horses. Where is the 4 horses? I told you yesterday, day before yesterday, about 4 horses. Then where are these points? Anyone tell? On which plan and on which meridian these points are? Stomach meridian, 4 horses point.
Which of the pictures are you talking about? Is it number 1 or 2?
Here is all the plans. I am not talking about one. I am talking about these 4 horses. Where is this point? The 4 horses. There are 6 pictures in front of you and 6 planes in front of you. Then which point?
4 horses.
Yes, 4 horses.
4 horses is on the stomach meridian between stomach 32 to stomach 34.
First point, 5.5 tune up from the lateral corner of the patella. Okay. From lateral corner to 5.5. Then another 7.5. And another 9.5. Okay. Every point have 2 tune gap. 2 tune, 2 tune. This is a great combination for treating all type of respiratory disorders and lungs problem. Okay. So lateral lines points. Area of the pain, Taiyang, Shaoyang, and patron, then pure Shaoyang channel. The points on the lateral lines here. This is lateral line. So all the GB meridian on this line. Okay. GB meridians, GB31 is equal to 88.25. Horizontal or vertical, then lateral 3 faces, GB34 T plus 2. So there are 3 points. Those are good for treating thigh pain, and it is a band. IT band points 88.5. Those are called thigh 9 mil, 579 mil, thigh 3 springs, 2.5, 4.5, and 6.5. So GB31 and 88.25, thigh 9 mils are 3 horizontal points. Using 3 points, 88.25, 88.26, 88.27 reaches the lateral to the superficial line and back line. So here you see if you are watching this, then which muscle is this? This muscle. Vastulis lateralis. That is on the superficial front line. This muscle is biceps femoris. That is the back superficial line. And this is the tensor ITBL band. Okay. It is on the lateral side. When you are using these 3 points, then it is treating all conditions of the pain. Front, back, and side. So this is a great combination of the points. That is called 3 here. High 9 wheels. Okay. Go vertical if symptoms are confined to the GB and lateral line, and if the tender points are there compared to 579 and 3 springs before the needling. Then 77.27 and GB34 use more for the shoulder and arms, wide separate systematic stagnations, emotional tension, and the internal disorders. You can reach the deep front line by angling towards the medial end edge of the tibia and using a long needle. No, typically GB31 88.25 is a great choice. However, there is variation in the way to each person. Hence, some clients will have more palpable tension in 579 or 3 springs. Then 22.27 lateral 3 faces. It is right or wrong? This point location is right or wrong? Name is right or wrong? I am asking you.
GB34 is right,
Right
sir.
here, 22.27 lateral three phase. It is right or wrong? From Indian students, not from Nigerians. I request to Nigerians, please keep quiet.
This is right, sir. Right point 34,
Then it-
GB34.
But I am asking about 22.27. Lateral three phase. Here is not a single point GB34. In pictures, you are watching 4 points. Then yellow is GB34. That is a different point. But the lower 3 points is Tung's acupuncture point. It is right or wrong?
Right.
Sir, this is, sir.
Yes.
Right, sir. This is point
Right,
right,
sir.
sir.
It is very wrong.
Why?
Have you read Tung acupuncture? How many members in this class very fair with the Tung acupuncture? And those are knowing Tung acupuncture, please tell me these points are good or correct or wrong.
Prof, can we talk?
No, you cannot talk.
Okay.
Because we are only learning the points. Everyone is asking me protocol. When I tell you, you put the point 77.27, then where you put the needle? This point is 77.27. I write here very wrong. Okay? Because in Tung acupuncture system, if I tell you in very brief, then it is a body, then on palmar front side, there is the point finger and front side 11 spines. Okay? 11. Then back of palm, all points are given sequence 2, 2. Then lower arm, it is 3, 3. Then upper arm, it is 0.44. Okay? Then plantar side of the foot, it is 55. Then top of the foot, 66. Then again, lower leg, 77. Now these points are on which area? 77. Then knee to hip area, it is 88. Then ear, okay, 99. Then head and face, 10, 10. Head and face, head and face, 10, 10. Then back line. Back line of the body is called DT. All the points are called on the back of the body in from T1 to sacral line. All point are DT. Then on front, from this area to pelvic area, all points are VT. So always remember the location. Whenever I told you 66, immediately you have a knowledge on the foot, palmar, foot dorsal area point. Okay, foot dorsal area. Then 22 hand dorsal area. Okay, so remember it. So for these points, indications, we are talking about these points. These points have a great indication: wide separate systematic stagnations, emotional tension, deep internal disorders. You can reach the deep front line by angling towards the medial end edge of the tibia and using a long needle. How you have to put needle? Angle of the needles towards the tibia bone. Towards the tibia. Then these points can be also be good for pain in the superficial back arm line. And when you see Taiyang, Shaoyang, back, lumbar and hip pain, reach the superficial back line by needling towards the soleus or gastrocnemius muscle. Reach the different line by needling towards the medial end edge of the tibia. Taiyang, Shaoyang and hip lumbar disorder. Then 4 orces and stomach 31 to 34 region, lower 3 empores and the spleen 6 to SP9 band. The rectus femoris muscles plays a primary role in the hip flexion and knee extension. where it is rectus femoris, where is this one? Rectus femoris. Then it is a playing role. It is two joint muscle. The first joint, if you see this joint with the leg, head of the femur, head of the femur, then another joint where? On the patella. Because it is crossing its tendon cross the patella and join with the tip. So it is a great muscles for two action muscle, hip flexion and knee extensor. If there is no power, then no one can do the leg very straight like this while laying. Okay. Then the points in the stomach 31 and 34 pain. The four horses can be used for anterior hip pain. Which pain? Anterior side hip pain. When you have pain in this region, then you use four horses. And in case where they are present with anterior pelvic tilt, tightness in the quadriceps muscles and locked knee. When the knee is locked, then you use the points, these points. Four horses. Four horses. Okay. Then lower three empowers SP6 to SP9 band. Okay. Treat a wide range of pelvic disorder. It is treating a wide range of the pelvic disorder. Not traditionally indicated. It is not given in the TCM. Okay. For the hips, but are initial deep frontline points, conditions of the hip, and especially when deep frontline muscle involve psoas, quads lumborum, deep lateral rotators, and piriformis muscles. So these points, if you see, then in this area, the three empowers, first point, same as SP9, equal to 77.70. Then SP6, 77.21. And the middle of this, okay, SP8 equal to 77.18. Oh, sorry, 19. Okay. Then location of the hand points on the superficial back for lumbar and hip pain. So when hip pain present with lumbar pain, it is especially important to use points on the hands. Posterior lateral hip pain pairs these with the shoulder triplates. The Z. Then 11.11 on the dorsal side of the middle finger, G line, okay, in the middle of this line, and the medial flange divided the flange into three, 1/3 of 2/3. So is the middle line, then is the middle flange, divided in how many parts? 1, 2, 3 equal parts. Then there is two medial parts. 11.11. And you can insert one needle directly in this part. For upper back pain. If there is lower back pain, then you put needle on this day. 11.12. Then 20 YST, YTX. YTX 22.07 Shabai between the second and third and fourth and fifth metacarpals. You see here. At proximal end of where the bones are covering. The 22.04 on the lateral side of the second metatarsal at the depression just proximal to the head of the bone, and where the shaft meets the head, same as Li3, needle toward Li4. Needle we have to push towards the Li4 like this. Okay. Then 22.05 at the junction of the first and second metacarpals, needling towards the Li4. Same just same. A 3 points combo between the second and third, fourth and fifth metacarpals. Make a loose fist and thread the needles down the length of the metatarsal. The piece, the puzzles together. So here is the points. These are also very good point for treating lumbar pain. When it is going on posterior side, not in anterior side. Okay. Then 33.08 and 33.09, you can see the location on which muscles they are. Common extensor tendon, extensor carpi radialis, extensor digitorum profundus, digitorum, and extensor carpi ulnaris. All are on the extensor muscle. 33.08 and 9. Okay. These points are using for sciatica, calf pain, and cramps, lung pain, leg pain in Tai Yang, Xiao Yang, and sciatic. Location between the Sengio and small intestine meridian. 33.08 is 6.5 tune above the wrist crease. It is the wrist crease. So first point, 6.5 tune. Okay. 6.5 tune. Then second point, 0.5 tune towards the ulna. 33.09 is 8 tune above the wrist. Then 8.8 tune above. Then here, what is the difference here? 1.5. Towards the ulna, and 33.9 is 8 tune above the wrist crease on the sensual line, and the 0.5 tune towards the ulna. Think about common places where tension gets held. The elbow is a common place. In many cases, 33.8 and 9 work like the sensu 5 and GB41 when paired with points on the GB meridians. I often prefer 33.08 and 33.09, Sensio 5 for the lumbar pain and sciatica. Though I will frequently needle Sensio 5 and more digital points in the earlier phase of the treatment. Press these points yourself now and see what feels more sensitive. Check on yourself, Sensio 5 and Sensio 6. And 33.08 and 9. Check it, which point is more sensitive on your body. Where does each client hold tension in the GB meridian and lateral line? These points have frequently resolved UB, sciatica, and the hip pain when other points reached together tolerance or did not work. A system of hip pain start with the superficial back line. The shoulder triclets 33.08, 33.09, Senjo 5, Lingo, Dabai, Siabai, and the pick 5 to 6 needles. According to overall pattern and conditions, needle contralateral. With these 3 to 6 needles, have them do the hip movements. After putting needles, you have to do and tell to the patient he move his back, in which condition is getting pain. Demonstrate in the video in hook movement routines. I will share it. Okay. Suppose that I have a back pain in lumbar region, and you put after putting needle, I have to move my hips like this, anterior, posterior, and lateral and flexions and rotations. All I have to do after putting needle. And for the second half of the treatment needle, the lateral line GB, or in some cases such as with the anterior hip pain needles, the stomach meridian on the thigh, system 6 added different line groups as needles such as liver 3, spleen 6, spleen 9. Okay. First 20 minutes of treatment and second half of the treatment. First, put the needles in first 20 minutes. Okay. After 20 minutes, you put second half treatment. Okay. On first, you putting needles here. Then on second, you are putting needles on the front and hip line. Okay. So, what you learn today? And what you understand? I'm not asking about Nigerian students. It's your revision class. Okay. So for Indians, what you learn in today class? What you learn in today's class?
Hip pain management.
It is helpful for you.
Yes.
How much it help you?
Sciatica pain.
Okay.
Sir,
Yes.
PDF and recording will be given because in between my network issue was there.
Okay.
So
But what
I try
what
to
you learn
put the
from
picture.
today's?
So actually, I have not done this too. So first, today is the last day, no?
Yes, yes.
So before this session, I missed, no. So starting this, from this, I understand if you are
Okay.
applying the points,
You are well understand?
pain is, beg your pardon?
You are well understand with this point or this system or not?
Sir, pictures are on the screen, they are not visible properly. So if we puncture, then how to puncture? And that I am this thing. So that's why
On the
first
pictures,
when you were
there is
showing,
no points. In the pictures, there is no points. There is facial plans. How our meridians are going and how they are circulating in our body.
okay.
Each picture have
Actually,
meridians plan.
yes. But in starting only you were showing on the fingers, no? I said location is not seen, no? So that I wanted to know. On the
Okay.
fingers he will be puncturing, no? That location. So that I am not knowing. Only theory part I am having notes, no? So that I am missing.
Okay. Any other review?
सर एल L4 L5 में अगर डिस्क पूरी तरह से सरक गई तो उसके लिए क्या करें कर?
देखिए मैं आपको की नोट्स दे रहा हूं, आप कंडीशन को समझिए और उसके बाद आप उसको ट्रीटमेंट की सोचिए। मैं डायरेक्ट प्रोटोकॉल आपको दूंगा, आप मेरी परिभाषा नहीं समझ पाएंगे। मैं आपको पॉइंट्स बोलूंगा, आपको पॉइंट्स जब तक नहीं पता है तो आप यूज कैसे करेंगे।
ओके जी।
देखिए मुझे पॉइंट्स बताने में दिक्कत नहीं है, एक्चुअली दिक्कत ये आ रही कि आपको पॉइंट उन पॉइंट्स की लोकेशन का ही नहीं पता है।
यस एग्जैक्टली, मैं भी यही कह रही थी क्योंकि अभी स्टार्टिंग में आपने उंगलियों पे बताया ना तो काला काला इमेज आ रहा था, इसलिए मैंने तुरंत ही बोला सर पॉइंट्स नहीं दिख रहे।
ओके।
कभी कभी कुछ कंडीशन में ऑपरेट भी करना पड़ता है सर, कभी मतलब ज्यादा अगर डिस्क वहां से सरक गई तो?
देखिए डिस्क वहां से कहीं नहीं हिलती है, एक्चुअली ये क्या है कि पोस्चरल कोरेक्शन होता है। ठीक है, जब हमारी बॉडी का पोस्चर ठीक नहीं होगा तो वो चीज कहीं ना कहीं फिसलेगी।
ओके।
अभी अगर मैं आपको एक चीज बताऊं और दिखाऊं तो आप समझ जाएंगे। देखिए ये मोमेंटो है, ठीक है।
जी
ये यहाँ खड़ा है, किस बेस पे खड़ा है? Why it is standing? Its main cause base is solid.
जी
Okay,
जी सर।
and its force is equally on the body. Okay, I am pushing this from here. You see, then what is happening? Tell me, what is difference in the momentum? It is stabilized or not?
नॉट सर।
Because posture is going wrong.
जी सर।
Let it go. Uh, stand on your position and I am walking normally like this. Okay, you are also walking like this. Now I am telling you a task. I say you rotate your both legs outer side. Okay, a laterally rotation of the your foot. You see my foot or not? My foot are like this. Okay, and you walk only 10 steps in your room. Then you tell me what is happening with you. I tell to everyone. If you walk like this, then you have a strong pain. You feel the tightness in the glutes medius muscle.
जी राइट सर।
Okay, it is
ओके
only posture change. Your body weight is same. It is not change within 1 minute. What? When you change your foot's position, it immediately change. Okay. 1 minute. I am showing you another thing.
सर, अभी अगर कमर दर्द है तो कौन से पॉइंट्स कैसे लगाएंगे,
1
वो
minute.
खाली बता दीजिए।
You see these children?
जी सर। ये है।
पोलियो है क्या सर?
Yes.
हम
दिस
CP child.
चाइल्ड इज हैविंग, अच्छा ओके
Yes, yes.
सेरेब्रल।
Now what you feel that which muscles are tight? Why is not stable?
सर एक कमर से ज्यादा प्रॉब्लम है उनकी।
No.
आप मसल्स के वहां पे टाइट है इसलिए बेंड नहीं
Watch
हुआ है
and
शायद।
watch again. No problem.
आई
Okay. I run it again.
Sir, full left leg is
Which
straight
muscles are
only.
more strong? Which muscles are more strong?
हिप हिप और पैर के दोनों की मसल स्ट्रांग।
वो तो hip adductors.
जी
Hip
हाँ, हिप
adductors are
एब्डक्टर।
very strong. Okay.
ओके।
Hip adductors like adductor magnus, longus, all are tight. Okay. Because of this, it is crossing the leg while he is walking. You see,
जी या
his
जी
both
सर।
legs are coming hyper adduction. They are going in hyper adduction because of more tightness in the hip adductor in this region. Then
ओके।
which muscle is this? So see, you see,
सर थोड़ा बॉल पे भी प्रॉब्लम लग रहा है सर।
left psoas muscle is working, but right psoas muscle is tight. Okay, right
ओके
psoas muscle is tight. Okay, then
जी सर।
you see, if you see full posture, then quadriceps muscle are working very strong. Okay, they are strong. See again. He is not able to move, flex this leg. Right side leg. Okay. Then
ओके
hands flexion also tight. You see hand flexion. Okay. And here, because of this condition, he is suffering a lot. Okay. So how you treat this type of children? It is telling in this facial plans. How many members walk as I tell you? And what you feel? Please share your experience now after walking.
सर हिप से नीचे तक
हिप से नीचे टाइटनेस हो रही है.
जी सर।
Okay. Now you try to walk like these children. How many steps you can walk? Try it. Then you understand the body mechanism. Now you try. And if you are walking like these children, then which muscles are strong and which are tightening and which are painful? Share your experience here. Because it is a diagnose. When you do practice on yourself, then you are much understand what is the problem, which muscle is weak, which is strong, where is not balance. Okay.
Sir,
Yes.
sir, both leg are weakness.
Both leg are
Weakness. Spinal cord injury. हाँ sir.
these children have so I request to Dr. Vamsi Krishna. Today is last day for our this free session. Okay. So you tell to all what about future.
सर
Yes.
ये जो बच्चे का बताया इसको जरा एक्सप्लेन करिए.
I will explain. Don't worry. You call call to me anytime. Okay. You have my contact number. No problem. But now it is time 9:40.
Indian time.
Yes. So Dr. Vamsi Krishna, please
Yes, brother.
share your yes.
So good evening, friends. So actually, 4 days, Ramesh ji was teaching the class from 4 days onwards. It will be, I think so, it will be very helpful and useful. If you, this 4 days class, it was very useful to you. Please text nice means N. If you feel this 4 days class was useful, please text N. Charts better, bro.
The recording is available.
Madam,
We will get
regarding the
recording.
class recording, I'm asking one question or asking other thing. So we'll explain, madam, recording about how was the class I'm asking. It was nice, miss. Please text N. So if you interact means we can know. Otherwise you cannot know. Indian, Nigerian or America, USA, Japan, whoever. So it will create interest for the trainer to teach more. We want to change anything also, it will right. Thank you for your feedback. So we are coming with the next upcoming programs. So next Thursday, Friday, Saturday, and Sunday will be the also very good concept. So Mr. Ramesh Jain will introduce that one. And also we are coming with clinical multi-therapy clinical acupuncture practical workshop at Bangalore from next month 20 onwards. It was a good opportunity for India who are there in India. So I think so Nigerian people, if they're interested, Ramesh ji will say you can come. So in India, they can utilize this golden opportunity. It was a multi-therapy integrated 4 days training program, interactive training program, live. It was not online or Zoom. It was a live program in that around, I think so, 10 to 12 therapies will be integrated, and the therapy introduction will not be there. Who are practitioners, how to improve their clinical skills to get good result by using multi-therapies like scalp neuroacupuncture, auricular, tongue acupuncture, TCM acupuncture, like that. So this will be happening at Bangalore. So if you are interested, you can ping to Ramesh ji. So Ramesh brother, you can just say your number, your phone number, please.
73 73 968 18637.
So friends, anybody interested, you can ping to Ramesh ji, interested or like that. He will share the other details also, flyers and everything. So this was a good opportunity for the practitioner who want to improve their clinical skills. And a regular online Ramesh ji sessions will be there. So please utilize this opportunity because he was spending his valuable time and you are also spending the time, his valuable experience which he had learned from the many gurus from 21 to 25 years. So please, nowadays many people will think free class means it was a free. So he want to share. It was not a, I mentioned free class. It was a knowledge upgradation course or enhancement course. So you had seen many big screen. He was showing the different type of things. So utilize this opportunity. So again, we will be back on next Thursday, Friday, Saturday, Sunday. So the more details will be updated soon. Okay, Ramesh brother.
Thank you, sir.
Yes.
Thank you,
Here
Ji.
is
Thank you,
my
Ji.
detail. I was showing you.
Look, sorry, number what was Ramesh bhai number type che. Yes, 1 second. We're typing the number also in text with the Ramesh bhai number. 1 second.
It is my here is my details.
Right. So phone number also they require by text.
Okay, if you
We will
want,
text.
I will.
If possible, otherwise we will text your number. Okay, all right.
Wait.
Super. You know?
Okay.
So you can see on the text screen that number you can note down. So anything related to the classes and anything regarding the treatment, he will suggest good protocol, good treatment methods. So you can utilize Rameshji's knowledge in a proper and systematic way. Okay. Ramesh brother, now the class is closing or anything balance we have to say to
No,
the
brother. I request to everyone, please open your cameras.
I'm open only.
So I can see who is joining today. Okay. Okay.
Good evening,
See,
Prof.
Good evening. Good evening. Good evening to everyone.
Good evening, sir.
Good evening, sir.
Good evening. Good evening.
Good evening, Prof.
Good evening, Prof. Good evening, sir.
Good night, sir.
Dr. Ahmed Murtala, if you are done, please call me back.
Okay, is it Dr.
Good
Ismail?
evening, Prof, and good evening.
Yes.
Good evening.
All
Good
right,
evening to everyone. I
Good
request
night,
you
sir.
all, please open your camera. So how you find my this experience? I have this experience from California National Acupuncture Council. Okay, and I have a credit score of 90 points from NACCOM.
You teaching very good, sir.
Okay. Good night to everyone.
Good night, sir.
If anyone have any
Good
doubt,
night, sir.
then you can call me anytime. And on screen,
Good night,
if
sir.
you are watching,
Good night,
then
sir.
hey,
Thank you. God bless.
contact number. Good night. Good night to everyone.
Good night,
Good
Ramesh.
night,
Very
sir.
good night.
Good night.
Sweet
Good night.
dreams. Okay,
Good night.
bye.
Bye,
Okay.
See you
Musala.
on next
Good
Thursday,
night,
friends.
sir.
You may
Yeah,
Nigerian
Okay.
time.
Good night.
Yes, sir.